Coast right now. Well, an estimated 10% of British Columbians do not have family doctors. And by 2015, the BC government would like to see that number shrink to, well, almost nothing. Earlier this year, the government joined with the BC Medical Association to launch a campaign called A GP for Me. And the goal of that campaign is to match every single British Columbian who wants a doctor but doesn't have one with a doctor who needs patients. As part of the campaign, a new online survey launched this week targeting Burnaby, and it asks doctors and clinic staff and residents there about their relationships or perhaps their non-relationships with a family physician. Dr. Baldev Sanghera is watching to see just what this survey uncovers. He's a family doctor in Burnaby, and he joins us on the line now. Dr. Sanghera, good afternoon to you.
Hi, Stephen. How are you doing?
I'm very well, thank you. From what you know already, why do so many British Columbians not have a family physician?
I think the problem is it has many, many reasons, and one of the reasons is that we don't have enough family doctors to go around for everybody. Part of it also could be that the services being provided by family doctors aren't at a convenient time for other people. So you'd say most family doctors don't open their offices late, and people want to access healthcare services late in the evenings, and we want to be home with our families.
Do we know what difference having a family doctor makes versus somebody who just occasionally, goes into a walk-in clinic when they need some medical help?
There's actually quite a few studies that have been done in the past on various different populations. Nobody's really done a full comprehensive analysis of a population like we're trying to do here in Burnaby now. But in the past, we've looked at patients with diabetes. And we found that if you've got an attachment to a family physician that helps to monitor your diabetes properly, you run into fewer crises, fewer complications down the road, fewer severe cases occurring, and also there's a reduced cost to the system.
And Burnaby,
something in the range of about 20 to 30% reduction.
So a significant reduction.
Yeah.
And Burnaby family physicians are doing the survey. Is the answer, though, not kind of obvious to anybody who's gone through the process of trying to find a GP? You don't have enough GPs out there, as you just said. Mm-hmm. It's hard to track down a doctor. And when you do, to schedule an appointment that works for you, is there, I don't know, could you have taken the money that it's going to take to do the survey or the effort of the survey and put it into actually getting us more GPs?
I guess we could have, but what we need to know is where are the real problems occurring, because part of it also is matching up the need with the demand. And sometimes, in the past, all we've run out with a bunch of money and throwing the money at a problem without really looking at it. And it's been since 1957 we've had MSP running, providing universal care, but we haven't fully assessed the community needs yet. So nobody's done that study, and we want to do that now so that we can reorganize healthcare to deliver care, to get better patient outcomes, and as well as have that better relationship between patients and doctors and save the system money.
Can we not, for instance, use the internet to match patients with the doctors?
Personalities matter. Right, so when patients come to see me, our personalities click, and I have to be their coach. I'm coaching them about their life, and so personalities do need to click. You can't just stick everybody with the number.
You are surveying clinic staff as well to see what they think about improving access to doctors. How do you avoid the risk of turning clinics into factories? They are so motivated by efficiency, the speed with which they're able to move people through.
Right.
Is that a good approach to managing somebody's health care?
Well, that's the whole point of trying to attach a person to a family doctor rather than to a clinic. The family doctor and the patient develop a relationship over time. And I act more like as a coach throughout their life. I deal with whole families. I don't just deal with one person. I'm dealing with multi-generations in families, and so I'm better able to connect with the patient with regards to what their healthcare needs will be down the road. And so I need to know what the patient's lifestyle is about, and I need to spend time with them. So it's not all about churning people through the mill. It's more about finding what each person needs, what their problems are, and finding the right solution for them.
This program, the GP for Me program, was piloted in White Rock, South Surrey, Prince George, and in the Cowichan Valley. Did you learn anything surprising in any of those locations?
Better patient outcomes.
With the GP versus without?
Yeah.
And is that because people are just more likely to go to the doctor if they have a doctor?
Yeah, and so if you have a proper relationship with somebody based on trust, and it's a mutual trust back and forth, if I'm helping you learn about your healthcare needs, and I'm trying to prevent problems from happening, and you trust that I'm doing it for your benefit, then you're more likely to follow through on lifestyle changes. If I have a committed patient, I can coach them to quit smoking. I can coach them to lose weight. These are tough things to talk about in a walking clinic setting. If you don't like what I have to say, you'll never show up again. But if we have a relationship, it works.
Is this idea, this notion that, you will have a family doctor pretty much for life or until they retire, is that an old-fashioned notion that people need to dispense with right now, or does that still happen?
It still happens, and I think we need to get back to it.
And do you think this is a realistic goal that the province has set, that everybody who wants a family doctor will have one by 2015?
Well, I don't know about 2015, but we're sure as well going to try to match everybody up so that they really can improve their health.
Dr. Sanghera, it's great to talk with you this afternoon. Thank you for taking the time with us.
You're welcome.
Appreciate it. Bye-bye now.
Bye-bye.
That's Dr. Baldev Sanghera. He is a family doctor in Burnaby. If you'd like to share your thoughts about finding a GP, you can fill out their survey. Head to the Burnaby Division of Family Practice website and follow the links. And that website is divisionsbc.ca/Burnaby.